Good morning, everybody. Welcome to Impacting Coffee. I'm Robert Blanqueta Nelson. I use he, him pronouns, and I'm joined today by my co-host, my wonderful co-host, Michael Green, and this wonderful panel today. We'll get to that here in just a second. But Michael, could you tell us a little bit about Impacting Coffee this morning?
Definitely. So thank you all for joining us today. So Impacting Coffee, we meet 3 times a month, the first 3 Tuesdays of the month, and basically it's a nonprofit networking opportunity where we bring people from different sectors within the nonprofit community to talk about their organizations, what they've been doing, what's working well, where they need help, and it's just a way that we can kind of create some of these great connections. So we're happy to have you all. And so Robert, today is also a Gratitude Tuesday. So Robert, is there anything that you're grateful for?
Thanks, Michael. It is Gratitude Tuesday. You know what? I am really grateful for the brisk weather. I love that it's cold outside. I used to live in Pennsylvania where it just snows like crazy, and when we moved here, it does not snow like crazy here. But I am grateful for colder weather. It means I can wear sweater vests and sweaters and all those fun things. I just want to remind folks, we just sent it off in the chat. Please introduce yourself as you're coming into the Zoom room too, but please also mute your audio and your video, please, so we can focus on our panelists. And welcome to Impacting Coffee. We're going to pass it to our wonderful panel today and introduce themselves and their organizations. And we're just going to pass off first to Jessie over at DVRC.
Awesome, thank you so much. My name is Jessie Fierro, and I am the director of the Victim Advocacy Unit for DVRC, the Domestic Violence Resource Center. I go by she, her pronouns, and I'm just looking forward to our conversation today. Yeah.
Awesome, Jessie. Thank you and welcome. I'm going to pass it over to Angel. Welcome, Angel, and thank you so much for joining us at Impacting Coffee today.
Good morning, Robert. Good morning, everyone. My name is Angel, she, her pronouns. I am from the Pueblo of Laguna, right down the road from here in Albuquerque. And this morning and lately, I'm finding myself very grateful for my health and just being healthy, kind of in everything that we're all experiencing together.
Thank you, Angel. I really appreciate that. And last but certainly not least is Bonnie Escobar over at Enlace Communitario. Thank you and welcome, Bonnie, to Impacting Coffee.
Good morning, everybody. My name is Bonnie Escobar, and I'm the new executive director over at Enlace Communitario. So I'm really excited to be here in Albuquerque, and I'm grateful that I'm currently here in Albuquerque because I relocated from El Paso, and things are a little crazy over there. So I'm glad to be here, and I'm really loving my time so far.
Thanks, Bonnie, and welcome to Albuquerque. We really appreciate it, and we really appreciate that you've joined Enlace Communitario. It means a lot, especially after having a long-lasting leadership over there. So this is really great to know that you're over there and filling really big shoes, but at the same time doing really great work too. So, we're going to dive right into questions, and we're going to just pass around and do it popcorn style and see how folks try to have as best a conversation as possible. The first question is, the pandemic has really exacerbated a lot of existing inequities in our communities. Could y'all talk about how your organizations have addressed a lot of those inequities and just faced up to some of those challenges? Because I know let's just be honest, it's been ridiculous, and it's not going to get any better. Well, it seems like it might get a little bit better. I think there's an air of optimism in the last week or so, so hopefully we'll cross fingers. But how have you all met some of those challenges? And I'll pass to Angel first, and we can go from there.
Thanks, Robert. So the Coalition to Stop Violence Against Native Women serves the 23 nations in the state of New Mexico. So all kind of over the state. And very early on in March, tribal communities shut down, meaning they closed off their borders. And so there was no one in, there was no one out of tribal communities. And that created some of these problems that we didn't even have were able to grasp like how to address them. So, for instance, when Navajo Nation went on lockdown, and it still goes on lockdown frequently now through the weekends, stay-at-home orders are in place, but folks can't leave to get groceries over the weekend, and so there's just like food access was a really huge problem for rural tribal communities. Water access, clean water access doesn't exist in a lot of the tribal communities. So those orders like, wash your hands frequently for 20 seconds. Well, a lot of the homes, some of the homes, I should say, don't have running water to be able to do that. When the governor back in March rolled out the executive order about essential workers, shelter and DV and sexual assault service providers weren't mentioned on that list. There's a lot of confusion around, are we essential workers? Do we stay open? And then very soon after that, if you were deemed an essential agency or organization, the state found a way to get you PPE kind of on that first round. But that didn't happen for DV shelters. And so we were scrambling, trying to find PPE before we knew if wearing a mask was effective from the CDC or the powers that be. We started kind of trying to find masks and get those out. And then there was, everybody was getting laid off of work. So we're an organization that does not provide direct service to clients. So we support the folks who support the people who are experiencing violence. And we started to advocate right away for hazard pay and trying to ensure and find out, where do folks, where do they lie with access to good health insurance, quality health insurance that not only will support being tested, but if you actually get sick, what's in place for our advocates right now in the state of New Mexico? So just these big problems that always existed: access to food, access to water, healthcare, fair wages, but they became so visible starting in March. So I know we're going to talk a little bit more about where we pivoted as organizations, so I kind of just like leave that there so I don't run out of things to talk about.
Thanks, Angel. I appreciate that information. I'll pass it to Jessie.
All right. So definitely what we are seeing is an uptick in numbers, along with the severity of the assaults, right? So it's becoming extreme violent, a lot of strangulation we're seeing, and a good portion of the time it involves a weapon. So it's just kind of bumped everything up a level, several levels, right? And so we're struggling with keeping up with the numbers. I know that we're trying to go after any grant possible, and any monies out there that's been afforded to the emergency funds for COVID. It's just honestly not enough right now. I think that we need at least 5 more advocates would be comfortable. Right now we have 6 advocates for the entire county of Bernalillo, and that's not including myself, which I do take on calls as well. So we're just trying to keep up with the numbers.
Thanks, Jessie. And I would love to talk to you after this. We can talk some more about like seeking funding and stuff through Pivotal New Mexico, and anybody who's interested. But we'll exchange information afterwards. Bonnie, could you take a what do you think of this question?
So first of all, I'm sure most people know that our primary focus is working with victims who are immigrants. And so I think during this time, some of the biggest challenges for that population have been, one, just as Jessie indicated, we've seen an uptick in the number of people who are being affected. And then this isolation just exacerbates already a problem in the home with domestic violence, especially with those who choose to try to work it out with their perpetrator. So it's just exacerbating. So we are seeing, you know, that, and then also too, I think as she indicated, that the violence tends to be much greater during this time. But what we've seen our population also struggle with is many have lost their jobs, or also too, they're being put in a challenging situation in terms of financially being challenged, but then now also having to educate their kids at home, which puts a lot of stress on the family. And so they're asking for assistance in terms of how do we do this? We don't have the technology to do this, and they really want to help their kids. So we've been fortunate that we have received some funds. We have our Promotora program where many of them have been educated in childcare. So we've been able to make some of those referrals. So for those people who are fortunate to still have their jobs, we can make referrals for childcare in limited and challenging situations. So we've done some education, I think, on what are the steps they have to take in order to remain safe, infection-free, etc. And so doing a lot of that. And then I think also too, we are seeing a lot of people desperately needing to leave their homes. And so we did get an infusion of funds from the city. So that's helped us place people in safe homes. And so now the challenge to keep them in those safe homes is the financial education and literacy so that they can manage budget, food, all of these new challenges that often the perpetrator, you know, didn't allow them to do. So I think that's been some of our biggest challenges. We do have a waiting list for people to get in. So our staff is definitely overworked. And I have also seen a real increase in the number of people seeking counseling, crisis counseling, where normally we can set up an appointment in 2 weeks so they can see somebody. We're having to bring in temp workers to address those crisis calls.
Those are all really tough challenges. I know our next question is a little bit about addressing this, so I'm going to pass to Michael to ask this next question.
Yeah, so you all have kind of touched on the answer to this a little bit, but what kind of impact, so can you discuss the impact that COVID has had on the community you serve through clients that you work with, or if you have any specific data that you can share with us? So it kind of builds on the last question, but we would love to hear about that. And Jessie, let's start with you.
You got it. So some of the things, I mean, we've already talked about people losing their jobs, being evicted from the homes, their homes, so finding them a safe place to stay. A good portion of time when someone is going through, when we're called out to a scene, an active DV scene with officers, the victim has lost their cell phone because it's been broken, it's by the offender, or the offender took off with it, something to that nature. So we're working on getting folks cell phones with minutes as well. The city has offered some funding for emergency placement for people, as Bonnie had talked about. And so that we're scrambling to try and place people into a safe place. Once they get to the point where they're feeling like, okay, I'm ready to leave, now they have to figure out, where do I go? And right now, hotels, I mean, it's very expensive. If you're in a situation like this, you're probably not going to have money to stay an extended amount of time at a hotel, or coming up with a deposit for another place to live. So, and shelters can only see, I think right now they're at 50 or 60% capacity. So, and they may have even gone down. I don't know if any of the other folks know about that. But we're just struggling to place people because of COVID limitations. As we talked about, having the staff to be able to handle the immense numbers we're seeing and the violent nature of these incidents that are damaging to anyone to hear and to know about and to help someone through, right? So, I mean, domestic violence doesn't only affect the person, it'll also affect the people around you. So yeah, I mean, it's a difficult time right now. And not being able to leave your home is I'm sure terrifying when that is the most dangerous place for you.
Thank you, Jessie. Yeah, it is hard to think about, not being able to leave home, and that's the worst place to be. And I think you also brought up an interesting point about how important it is to have a mobile phone or a cell phone. That's kind of your lifeline and your contact with the outside world. So there are some great things that you guys are doing, so we appreciate that. Excellent. All right, so Angel, if you can share with us ways that COVID has impacted the community that you're also serving.
Sure. So I think the biggest impact and something that is going to have the longest lasting impact is advocates doing this work from home. Now, imagine being an advocate, being able to go to work, do your job, have some of these really hard conversations that take a toll on your heart, right? They're really, really tough to navigate. But now they're doing it out of their own home, where home before could be a sanctuary. And so how are they able to separate work from home? And they're, in a lot of ways, they're inviting this type of energy into their sanctuaries. And we don't have a solution for that right now. So that's kind of a big impact that we're seeing. Jessie talked a little bit about this, the shelter model. So when stay-at-home orders hit, capacity for domestic violence shelters went down to 50%. And so folks who do make the decision and try to leave were faced with limited options. And so service providers like Enlace or other shelter through the state had to find additional funding to put folks in hotels. Hotel capacity went down too. And so there were some instances very early on where actually finding a hotel was an impossibility. And then you actually get the survivor into the hotel, but then they have to access counseling services. You have to figure out how to get them food. You got to figure out everything that worked. So I think one of the biggest impacts is that the shelter model is one piece of the solution. And now we're at a place as service providers where we have to figure out how to meet survivors even more where they are, because they can't come to us all of the time. The toll on the system. So when the system shut down, getting a restraining order, trying to check up on your court case, like when Second Judicial shut down a couple of times when they had an outbreak, a lot of folks were scrambling, trying to figure out how now do we access these safety net services that we were able to. And then for tribal communities, think about when they do shut down and it gets to a point where survivor actually has to leave the home. That means they have to leave the community. And so there's all of these other arrangements that need to be made when the survivor leaves the community. And then because there are only 2 tribal shelters in the state, when they do seek shelter outside of their community, going home, getting back home is another kind of like barrier to have to figure out a way around. Now, who do you have to share your story with that maybe you didn't want to share your story with about the need to leave or come home? Another impact was the racial tension that's been created, especially in border towns. So communities like Gallup, communities like Alamo, communities like Farmington, at a certain point during the pandemic, 60% of the cases in the state were Indigenous folks. And it was easy and simple to make the argument that we can't have them in here. And so we saw a lot of those tensions rise and continue to exist right now. And then a big impact for our staff at the coalition is that COVID didn't happen and isn't happening in this way that we talk about it hypothetically. It affected our staff. They lost family members. They're losing family members. We don't get to address this in a way that hasn't touched our own lives. So that's another really big impact that we're navigating our way through.
Yeah, thank you, Angel. I mean, yeah, working from home and seeing how complex everything is interconnected with each other and having family members, there's a lot to kind of digest and think about. So thank you for sharing that with us. All right, Bonnie, same question over to you.
Wow, so I'm still kind of absorbing a lot of what Angel said, but I think, so for us, it's challenging. We were already a bit short-staffed, and so now that we're getting more and more people calling and needing support, it's put a huge strain on our staff. The other thing is, we have attorneys and paralegals, and so right now we actually don't have any attorneys. We lost the one that we did have, so we're searching for an attorney. So our paralegals are really stretched because we want to make sure that our clients are able to apply for protective orders and to get that done. But also many of them are in the midst of applying for status. And so a lot of that has been put on hold. So it's put, I think, even more stress on the family structure, wondering what's going to happen when we're living in a climate that is not friendly to immigrants. So I think that kind of adds to the stress level. And so the other thing too is that I think that we've also seen, while we've seen an uptick in the number of crisis calls, people wanting some counseling immediately to kind of deal with what they're going through, is we've also seen an increase in the number of calls in terms of, can you help my children? Because the children are really feeling a lot of the impact of this. And I think sometimes they might be forgotten, but while their family, the heads of household are going through this, they feel it, they see it, and they're also being affected. And so we're trying to at least have some of those dialogues via, the Zoom calls, and doing some of that in a group format to at least be able to address several kids at one time, so that they can talk about what they're going through, what they're feeling, trying to address some ways that they can think about. I mean, this is a very adult problem, but kids are going through it. So you still have to give them at least some skills in how to try to deal with it. So I think that's been a big challenge for us as well. And so that's kind of what we're struggling with, is staff shortage, people applying for jobs in the midst of all of this. How do you do that? And we're all also, I would assume, like with Jessie and Angel, we're probably in trying to increase our staff. We're seeking and reaching out to the same people. So we're kind of competing with each other. And I think that's a challenge as well. So there's kind of all of this stuff has just come to to come in all at once. And it's affected, I think, mentally a lot of our clients.
I agree. And I also would like to echo the kids aspect of this, Bonnie. I mean, I can't even believe we didn't talk about that initially, because right now, I mean, their minds are forming, and their way they love their future people is they're learning right now. And maybe that's not the best example, of course, right? And so we need to. We're also trying to figure out how to create groups so that we can involve more people but virtually, so that it's safe. So we're just, I mean, it's really kind of a game trying to navigate that, navigate that, the COVID, the brutality of everything, the staff working from home, competing, as Bonnie said, for funds, because that's exactly right. We are competing for funds, and so if we're getting something, Enlace is not, or vice versa. So it's difficult. Yeah.
I thank you both for especially bringing up the children, and how once you get children involved in all of this, it does become way more complex, and you have to be a lot more careful and all of that stuff. So thank you all for sharing those experiences. Now I'm going to send it over to Robert, who's going to ask y'all the next question.
Yeah, and just thinking about what you've said, Bonnie, and especially about competing for funding and for a small pot, so we've seen a number of funders step up for certain amounts of funding for organizations, but obviously there's kind of a gap that still needs to be filled, obviously. And so, and Angel, you brought it up too, when you're in a hotel room, when you're placed in a hotel room, then you have to access online counseling. How do you access that without a computer if you don't have one, or access to broadband or anything like that? So my question for y'all is, have you all applied for any of it sounds like some of y'all applied for the PPP funding and the PPE funding and stuff like that, but what has your experience been in some of those funding, getting funding from those avenues, and how can funders be more responsive to your community's needs right now? And I'll pass to, actually, because Bonnie brought it up, I'll pass to Bonnie.
So one is, I have to give full credit to Claudia, my predecessor, who has set up the organization financially in a very solid position. So as we came into COVID, we were in a really good financial place. And I know that there are a lot of agencies who are not in that same place. And so I think our challenge is how can we help others? And while I don't want to overburden staff, one is to make the referrals, because we have some resources. But the other challenge is we still need to continue to bring in some of those resources. So while we've been able to put people in housing at the very beginning of this, like I said, the struggle is keeping them going and being successful in that housing so that they can maintain that residence. So it's providing them access to food, to local pantries. A lot of times too, it's I'm paying all my other bills, but I can't put gas in my car so I can actually go to work every day. So providing some of those simple things that we take for granted. And also just some of the items, taking care of kids is expensive. And so we want to continue to do, so we've kind of gone through all of our funding, but we still have families who are saying, we don't have a laptop, so our kids can learn, virtually. So that's kind of one of our challenges, is the technology piece. Plus our agency just had to completely, since we went, virtual, everybody in the agency got a new laptop. We've had to update servers. So that cost was unexpected. But the upside of it is now we have the latest technology. But I think that's the challenge, is balancing and making sure that our staff have all the tools that they need, but at the same time, then making sure that the families that we've placed remain successful. And so that continuing case management and support for the everyday needs that they have. And so we've got a pool of funding, but we're going to continue to need that funding as more and more people come to our door.
Thanks, Bonnie. I appreciate that. I'll pass it over to Jessie. What do you think of this question?
Well, so we've applied for everything that we've come across for emergency COVID funds, the CARE funding. Now we have received small increments of grants from different places, and that went to updating our server as well. And we're still in need of many technology pieces, so we're working on that. But for us, the most challenging piece is it costs $150,000 to employ 2 advocates full-time for the year with benefits and all of that. So that is our biggest challenge. Raise that much money, I don't know how. You know, we're working on that. I don't think the money's there right now, but I don't know. Hopefully we can find some, because we need it. We need to bring in some reinforcements for our staff and additional counselors as well, because I know that we have a waiting list of probably 2 months out for, but they can get an assessment within 2 weeks, and then we can start working on hopefully groups before the individual, because the individual's going to take up to 2 months to be able to fill. So crisis counseling right now, especially DV focused, is very difficult to find. We're also getting a lot of calls right now for that are offenders calling, or people that are struggling with having abusive tendencies and not knowing how to handle that aspect, and reaching out. Maybe they're COVID has gotten to them. They're realizing, oh my goodness, I can't control my emotions as easily as I could now. And really at that point, we're referring out, because unfortunately right now we're unable to help in that sense. We need a whole different building and area to work from as well, to keep everyone safe.
I really appreciate your candor on that one, Jessie. I really thank you so much. Angel, how would you approach this question?
Sure. So when it comes to the funding piece, we had 2 big situations happen in the very beginning of this. One was, one of our largest funding streams was from a funder whose ability to give was tied directly to the stock market. You can go and you can read who this organization is, because it wasn't a secret. But we got an award letter in January, and then we got but this will only be 1 year of funding in March. And so that hit, and it hit hard, and it hurt. But the Coalition Stop Violence Against Native Women is great about telling our story. I think that when it comes to addressing the issue of domestic violence and sexual violence, we have to look at all of the pieces of where it intersects with the larger societal issues that we see. So all of these social injustices, pay equity, racism, reproductive justice, right? We as service providers need to get comfortable advocating for all of these intersections, because there's funding opportunities at all of those intersections. And the more unapologetic we are in our stances about that, we found, at least as the coalition, that the support has followed. So that's been kind of our saving grace as an organization. Another opportunity that happened in March or April, I can't remember, a funder reached out and within 2 weeks wanted us to apply for some grant funding, and we just weren't there. 2 of my staff had lost direct family members at that time, and it was just not something we were capable of doing. And so some of the things that funders can do is be flexible with us as grantees, learn what kind of might be really going on in the organization, have a dialogue that's really honest and vulnerable, or allows for us to be, at least. I think funding that might be in place right now, folks need some flexibility, because there's so much innovation that could happen during this time. One of the projects that we had was around food security and food access. So the National Guard was coming in and delivering food boxes in tribal communities, and that was became a regularity. But there wasn't that same opportunity here in the city, where we know about 11% of the population is Native here in Albuquerque. And that's a huge percentage of the population that wasn't being served, but experiencing the same issues that rural tribal community citizens were facing. And so it's a drop in the bucket, but we did a food program where we got folks food and a cooking lesson and a stipend and some equipment for their kitchens. And we just spent an hour with them every week, cooking what was in these food boxes. A lot of times it was like charred, something that a lot of people just are like, what is this and what do I do with it? So we invited them and their children to the cooking lesson. And that kind of stuff is violence prevention, right? It's alleviating different kinds of stressors in the home. And so if funders are able to allow their grantees that flexibility in getting creative, that's another a solution. And then reporting. So we did get a couple of smaller grants during COVID, but the reporting requirements during those times, it's tough and it takes a toll on the grantees. A lot of times we just want a need to get to work. So reduced reporting requirements would be great. I have some funders who allow this kind of dialogue for a grant report. And that's just the best way for at least us as an organization to be able to talk about our work, highlight some things that are working. And it eases a lot of the administrative burden on the staff.
Angel, thanks for that. I think that totally hit the nail on the head in terms of responsiveness too. Like I love the creativity around that. Yeah, Michael, I'm going to pass to you for the next question.
All right, so we're going to change the tone a little bit here, and I want you all to kind of brag and talk about some of the great things that your organization is doing. Maybe talk about something that happened during COVID, some change you made that you see having a long-lasting impression. And yeah, so now we want to hear about the great things and the positive things that your organization is doing. So Bonnie, we'll go ahead and start with you on this one.
Well, I'm trying to think. So I think one is our staff has been super flexible in converting to this kind of virtual case management and assistance. And so I think that has been a huge success story for us. You know, we still have some technology challenges that we're working our way through, but I think the fact that, you know, they kind of said, yeah, they had that kind of, yeah, we can do this, you know, let's just go at full force, I think is a success for us that our staff has embraced this. And by the same token too, I think that, you know, we've tried to continue to do that outreach and education in the community so that people are reminded that our doors are still open, that while COVID has closed a lot of doors, that the social service sector, I think as a whole in Albuquerque, has said, we're here and ready to help. So I think that's a success that we can all celebrate. And the biggest impact that this has had on our organization, what I now struggle with is I worry, now I'm a worrier anyway, but I worry about how our staff continue to do this. We thought it was going to be 6 months. It's been 10 months now. We're probably going to be at this for another 6 months. And so that's the next challenge, I think, hurdle, keeping staff and people motivated and refreshed. So.
All right, thank you for sharing that. I think right now, especially, everyone has to be flexible. And you mentioned that, yeah, your staff has been flexible, and as I mean, we don't know what's coming next or anything. So that is huge. So it's great that we are pretty resilient in that manner. All right, let's go to Angel. Same question for you. Let's hear about you brag about some of the great things that you've accomplished.
Thank you. This is like the uplifting part of what we get to talk about. So thanks for the opportunity. So I had mentioned earlier in March, we were trying to figure out how to get advocates hazard pay or time and a half, especially in the tribal shelters where they're making $8 or $9 an hour. You know, they're making the federal minimum wage. And so we had gotten to the point where we were on the verge of just hiring them as part-time employees to be able to just get them this additional money. But then our accountants came back, just like, pump the brakes, Angel, we cannot do that. But actually, here's the workaround. And we, to date, have been able to offer $43 $500 stipends to victim advocates in tribal communities here in city with minimum training requirements. So it really is just, how do we support the members of the Coalition to Stop Violence Against Native Women, which is a huge pivot in our budgeting, right? So that was a major accomplishment for last fiscal year. And then we usually bring together 40 youth every summer for a Native Youth Summit, where we have conversations, equip youth with training and tools to have tough conversations, to break cycles of violence in their own communities. But this year we've changed it to 6 cohorts of 10, so a lot smaller groups, and we are addressing the intersection of Black Lives Matter and the type of violences that we address. And so our theme is Black and Indigenous solidarity, where when it's all said and done, we will have brought together 60 Native youth from around the state. We give them a laptop, we give them $200 to participate, and we teach them how to hold their leaders accountable. So write a letter to your congressperson, to your tribal leader. We equip them with the tools that we kind of see people need right now to demand justice for our communities. We also had a 5K in October, which is the first time we had a virtual run, which is really exciting. We had 381 registrants, and our staff was able to get out a t-shirt and a run packet to everybody. And we had folks from all over New Mexico, but also all over the United States, come together and dedicate their run to survivors of domestic violence. And some of the most beautiful stories come out of that run, of resiliency, of honoring the experience that a lot of Native women have, and a beautiful opportunity for families to tell their story and connect with one another. And so that happened in October. We're continuing on with the food security, food access, food sovereignty programming that we have. So we're partnering with a great organization based here in Albuquerque, Three Sisters Kitchen, going into winter and next year around the intersections of poverty, racism, capitalism, and food access. And so that's coming up, and we're really excited about it. And then we can't take care of these big issues if we're not taking care of ourselves. So one of the biggest changes that we were able to make was to offer our staff stipends to help offset some of the cost of COVID. We're all paying higher internet costs. One of our staffers moved back home, and when you're in a rural tribal community, sometimes your internet is $200 a month, and that is ridiculous. So we talk about the inequity, and Jessie and Bonnie both talked about this a little bit. The state of New Mexico needs to prioritize broadband and spectrum infrastructure for the entire state of New Mexico. This is where we are now, and it's where we're going. We need this. Tribal communities need this. People who are on the fringes of the margin deserve broadband access. It's a safety issue. And we had some staff, who couldn't focus on work because they're also teaching their little ones, and so we were able to offer a monthly stipend to help offset whatever costs come up. You don't need to tell us. This is just us supporting you, and thanking folks for doing that work.
That's awesome. It sounds like you've had some some success in all of this. So that's wonderful to hear, especially with the youth, and you're being able to still provide them with the great programming that you had, because I mean, they're suffering just as much being stuck at home and not interacting. So I know that they definitely appreciated that. So it's great to hear what you're working on. So Jessie, let's hear.
Well, so huge thing for us was we have advocates that go out to the scene on emergency domestic violence calls with officers. They can help with emergency restraining orders and transporting to shelter, going to the hospital and transporting home, the victim home. So we really needed reliable vehicles. And that is something that, that we have never had, to be honest. We were fortunate enough to have some vehicles in the beginning with that were APDs, allowed us to utilize some of their vehicles. And now we were able to, with CVRC's help, purchase 2 brand new Honda Civics for our advocates to utilize to transport. And it's been great. That has opened up so much for us. And just the idea of being safe when you're going out to God knows where, right? Because we just get an address and we go. So just knowing that we have a reliable car to transport people around, transport ourselves around, get home at the end of the night safely, makes a world of difference. So thank you, CVRC, for that help. And then, of course, I have an amazing team. We've added new team members to our staff, and we have quite a few new counselors, and I'm very proud to be a part of that. Very proud.
Awesome, thank you. Yeah, it's great to see the good and all of the bad that's happening. So yeah, congratulations on getting those 2 new vehicles. And I mean, that'll definitely help you once the pandemic is over and everything. So congratulations on that. I'm going to send it over to Robert, who's going to ask you all the last question of the day.
Yeah, I mean, knowing that it's 9:47, I think the one thing I remember from last week was that we asked this last question and then we didn't have that much time for networking. So what I'm going to do is we're going to pivot a little bit. I'm going to ask this last question: what can our communities do for y'all today? And then we're just gonna hop into the breakout room so folks can y'all can talk about that with folks in the audience, and that way we can create some great conversations in the breakout rooms. And so I know we have just a few people in the audience right now. So folks, as you're thinking about it, we'll do 3 breakout rooms actually. So as you're thinking about it, to our panelists, what can our community do for y'all today? We'll break you out into separate rooms so you have at least one of our panelists per group, and that way y'all can kind of break out and talk about that some more. And then also just for our audience members, introduce yourselves if you have any questions about our panel today, and then just maybe offering anything that you might be able to in terms of volunteer work or getting connections to other resources or donors or anything like that. That would be extraordinary. So I'm going to break everybody into breakout rooms just right now. Our question is, what can our community do for y'all today?
Before you get started on that, if we could have the panelists write their contact information in the chat, so that way if any of the participants want to follow up with you all in the next couple of days, that they have access to you. So yeah, if you could just share maybe your name, your email address, and phone number in there, that would be great.
Thanks, Michael. I appreciate that. So we'll break out into 3 rooms, and there'll be quite a few people in per room, but that's good. Big huge round of applause, or virtual round of applause, for our panelists. We'll come back here in about 10 minutes, but folks, enjoy the networking portion of it, and thank you again. We'll come back here in about 10 minutes. Awesome, y'all. I hope everyone had really great conversations in the breakout rooms. I just wanted to say a big, huge thank you to all of our panelists, Bonnie, Angel, and Jessie. Thank you so much for joining us today for this wonderful conversation. From our audience, can we get a big, huge virtual round of applause from folks? Just press the emoji button, or just, claps. Jazz hands, Greg. Thank you so much. I appreciate that. We'll make sure that the video is available for folks on YouTube very soon. Big thanks to our audience members too for joining us. I see a lot of familiar faces out there. I hope you're doing well. It's good to see people virtually. I know hopefully we'll see you someday in person. I miss all of you, and we will hopefully see y'all soon. And big thanks to the Impact and Coffee team, Michael, Aaron, Juan, and Brianna. You all do some really amazing work, and we really appreciate everything you do. But I wanted to wish everyone have a really great rest of your Tuesday afternoons and a really great rest of your week, and stay warm today, because I hear it's going to get a little colder. So I already put on my sweater. So
Robert,
oh, sure.
I just want to encourage everyone to apply to our Next Gen In grant. We are encouraging any organization that are empowering youth to join the nonprofit sector to apply for funding. We have about $4,000 to $5,000 grants available, so definitely apply on impactandcoffee.org or check out our Facebook page with more details.
Awesome. Thanks for that, Brie. I appreciate it. I also linked the email if you have any questions about NextGen In. It's nextgenin@syncnm.org. What's the email? I believe that's the email. If it's not, I apologize beforehand. But I hope everyone does well. I will actually connect with all of our panelists and some of you virtually here in the next week or so. But I just want to wish everybody again, have a really great Tuesday, and may all your lights be green. See y'all later. We'll see you soon.